we go. Well, hello everyone. This is Dr. Jeffrey Hanna at Atlas Health. Hope you are doing well. And what are we doing in one of these videos? We're checking out some other things. The big idea. What is the big idea? The big idea is where we're going to take a topic that is of importance, value, interest, and we're going to spread it out really, really far and talk about some of the details and all this sort of stuff. But we're going to do that so that we can explain really important ideas in plain English for two groups of people. Number one, for other healthcare practitioners who need to know this information, but arguably even more important, for people who have been experiencing these different kinds of challenging health issues, who are looking for answers, looking for options, looking for solutions for things that might be able to help them out, that otherwise they're not aware that this information even exists. So, what we're going to be talking about today, we're going to be talking about findings that keep showing up on MRI for people who experience myalgic encephalomyelitis and chronic fatigue syndrome. I'll back up just a little bit just before we get the ball rolling there. So what is it we're talking from a symptomatic standpoint? So chronic fatigue kind of speaks for itself. Persistent fatigue. You have no energy. The battery is flat, and despite your best efforts, it's not picking up. Myalgic encephalomyelitis, what is this? Myalgic refers to muscle pain, encephalo refers to brain, and myelitis refers to inflammation or swelling of nerve tissue. And so what this is this is a condition where you can look on an MRI, you see signs of some brain swelling, and the consequence of that, they believe it's related to full body fatigue, full body pain syndromes, very, very similar to fibromyalgia, chronic fatigue. They all fit in the same family category of different conditions like that. So what we're checking out here is a paper that comes from August 2020. As always, we're going to rip through the summary really fast, and then we're going to break it down and discuss what it actually means. Here we go. The pathophysiology of myalgic encephalomyelitis and chronic fatigue syndrome is unknown. In this study, we test the hypothesis that hypermobility, signs of intracranial hypertension, and craniocervical obstructions may be overrepresented in patients with myalgic encephalomyelitis or chronic fatigue syndrome, and thereby may explain many of the symptoms. Hypermobility was identified in 50% of participants. MRI of the brain was performed on 205 participants, of whom 55% had an increased optic nerve sheet diameter, and 83% had signs of possible intracranial hypertension, including 32% who had values indicating more severe states of intracranial hypertension. Cerebellar tonsils protruding under the McRae line into the foramen magnum were identified in 56% of the participants. MRI of the cervical spine was performed on 125 participants, of whom 180% had craniocervical obstructions. Pain at harmless pressure, allodynia, was found in 96% of the participants. And FMF, why am I drawing a quick blank there? It's while I'm looking through this. Fibromyalgia symptom was present in 76%. Compared to general population, we found large overrepresentation of hypermobility, signs of intracranial hypertension, and craniocervical obstructions. Okay, there's a lot of stuff to unpackage here. Let's start first, and for the sake of simplicity, from here on out, I'm just going to say chronic fatigue syndrome. Yes, this can apply to fibromyalgia. Yes, this can refer to myalgic encephalomyelitis. But for simplicity, I'm just going to say the one, even though there are these subtle distinctions between them. Years and decades past, people, and it usually shows up in women, but guys are no exceptions to the rule, it can show up in kids too, would be describing these quote, bizarre symptoms, the full body fatigue, the full body pain, all that sort of stuff. And they were told it's all in your head. This is, just get over it. It's all in your head. It's a psychological condition. Stop wasting my time. Different things like that. And to a certain degree, people can feel like there's a ghost living in their body that's basically hijacked the system and it's not working the way that it should be. The point being is that the underlying condition as far as, what causes things such as a chronic fatigue syndrome is relatively unknown. I have done a number of different videos in a number of different places where I refer to chronic fatigue syndrome. Firstly, well, what it's officially known as is a diagnosis of exclusion. And by that, it means that you've had this blood test, you've had that scan, you've had all of this stuff, but nobody can identify true blue pathology that says, you have this, therefore that is what causes chronic fatigue syndrome. Now, what I contend is it is more of a combination lock kind of problem. What a combination lock kind of problem is where there is not just one thing that causes it. It is where it is most frequently a combination of a few things. And in addition to that, it can be different combinations for different people. So what are some of the common ones that are associated, in terms of the belief for people with chronic fatigue syndrome? Okay, well, you've got chemical toxicity, you've got virus infection, namely something along the lines of an Epstein-Barr virus. You can also throw in there Lyme disorder, so the Lyme, the Borrelia bacterial infection. You can throw in there heavy metal toxicity. You can throw in there post-traumatic stress disorder. And by that, it's not always the stressor itself that causes the issue, it's how we perceive what it actually happens. So sometimes even very slights can cause us basically to blow a metaphorical fuse. And then there can also be the underlying physical components, overtraining syndrome, any number of different physical injuries, all that sort of stuff that we're kind of going to look in this article. And so each of these, I do believe, very much has its merit. But what it also means is it means that just because person A, who you read about on the internet, who had a miraculous recovery when they had treatment A, it doesn't necessarily mean that that is true for all people who experience chronic fatigue syndrome. It's absolutely worth exploring, but it's important to recognize that that combination is very frequently different in every single individual. And it's important then that not just the single healthcare provider that you're working with, but really the team that you are working with is working in a hierarchy and in a logical sequence so that you have the best possible chance of getting these improvements from these other kinds of issues. So, now that we understand that really that first sentence, pathophysiology is unknown. What these guys in this particular study wanted to look at is they wanted to look not necessarily if any of these sole factors would cause chronic fatigue, but is there overrepresentation in a group of people who experience chronic fatigue, which may suggest that these things are risk factors. These things are pieces of the puzzle. These things are one of the contributing issues that if you can resolve it, then it might be able to help these people out. And so what were they looking at first? I might go, well, let's start with a simple one, hypermobility. What this means is this simply means excessive movement. Movement in the, and they're saying specifically in the upper part of the neck, where the base of the skull meets the C1 and the C2 vertebra. Hypermobility is simply put where the normal ligaments that hold everything together are moving a little bit too much. I've done another video here which talks about how when you have excessive amounts of mobility through the ligaments in the upper neck, what can happen is the muscles through the back of the head to tighten. If the muscles in the back of the head start to tighten, that then in turn can start to affect joint position and ultimately produce tension, which affects the function of the nerve system in that area, and that's only what controls all the communication between the brain and the rest of your body. That's it. But it also influences fluid flow. Not just blood going up and down from the brain, but also the circulation of the fluid around the brain that provides you with the energy, the oxygen, and all of the other nutrients that you need in order for your brain system to work in the first place. So then if you have this hypermobility, so ligament injury, think of it like that, and then if you have the intracranial hypertension, this is where you start to have abnormal buildback of pressure because you have too much fluid going up, it's not draining out properly, and it's also, as a consequence, it's not circulating properly, that what it can do, at least in terms of what they're looking at here, is it can actually cause the optic sheath to start to bulge outward. The example that you might be familiar with that is that of glaucoma. Why is it that when you go to see the optometrist, they spray air in your eye? And why do they look to see what's the size of the disc in the back of your eye? It's because your eyeball is actually a physical extension of your brain. And so if you see the normal features that are starting to bulge outward, coming at you more like this, when you're looking in the eye, you're like, okay, that's not good. There is because there is something that is causing a backlog of pressure on the inside. And you have to rule out things like bleeding, tumors, infections, all that sort of stuff. But in chronic situations, it's very possible that, okay, there's no lesion, but there's an excessive amount of fluid. That's what's causing the bulging to back up. And we'll talk about how that fluid then in turn can be related to things in the neck. And lastly, what they talk about in terms of what's called a craniocervical obstruction. What they are referring to is, think of it like a physical blockage is the short of it. You have the normal spinal and the nerve canal that comes like that. So an obstruction then is anything that makes that opening slightly narrower. In this particular paper, they are going to talk about discs, and they're also going to talk about what's called a retro or an anterolisthesis. It's slippage of the vertebral body one way or another, which causes the normal amount of opening in the nerve canal to get a little bit narrower. If it is narrower, there is not as much room for that transmission, that life cord between your brain and body to transmit those messages. And they believe that that can be, again, one of the things that may be associated with dysfunction in the brain, abnormal messages going up and down, and as a result, this quote-unquote phantom fatigue, phantom pain, neural facilitation, neural fatigue that then we call fibromyalgia, myalgic encephalomyelitis, chronic fatigue syndrome. Again, recognizing that it's not because of a tumor or any of this sort of stuff, that it is because the way that your system is working is being affected in some form or another. So as we start to slide through this, they talk about how exactly did we measure all of this stuff. Basically, they took MRIs and they said, okay, based on the MRI, are we seeing signs of bulging of the neural sheath? Are we seeing swelling on the brain? Are we seeing signs of occlusions or narrowing? Again, they're using the word obstruction in terms of what is actually, going on. Is there something that is narrowing the opening? And this is something that's pretty interesting, I think, for any person who is, again, they experience these symptoms, they've been to any number of different practitioners, and they feel like they're all alone and all of this sort of stuff. This doesn't necessarily help soothe that, but this hopefully will help you appreciate that you're not alone in this. The mean number of contacts in the healthcare system for the patients that were in this study over a 5-year period was 90. Which means that they had gone to a healthcare practitioner on the average of 15 to 20 times per year. They were seeing a doctor or a specialist at least once a month. The mean number of diagnoses that the participants had received, the mean, that is the average, was 20. And at least 3 more said, it's psychiatric, it's a PTSD, or it's all in your head, or it's something like that. You've heard me talk about this on a number of videos, that yes, there is value in diagnosis, but diagnosis tells you the effect. The effect is chronic fatigue. The effect is fibromyalgia, but these are not things. What's far more important is not the effect, it's what's the root cause. What is causing this, or what combinations of things are causing this? Because if you understand that, then that gives you an opportunity. What do we do to help you out? No matter what the fancy name is going to be. What's more important is root cause. What can you do about it? So just wanted to let you know, okay, as horrific as it can be, especially if from the outside, and especially if even a relatively short time ago, you said everything felt good and I just want to have my life back. That there's a lot of people who understand, even though you may feel, there's a lot of people who understand exactly how you feel. And I know that that doesn't necessarily solve it in and of itself, but it is important to know that you do have that community of support that is out there. So they go through and start recording all of the values and all of this sort of stuff. And so what do they start looking at? I'm not going to reread all of the numbers and all of that sort of stuff here. Well, actually I will, but I'm not going to go through them all in that particular part. So the first thing that they go through, they have the hypothesis, the belief, that general joint hypermobility and craniocervical obstructions, so joints moving too much, ligaments being a little too loose and sloppy, and a physical blockage would be overrepresented in patients with chronic fatigue syndrome versus, say, the general population. So let's say we take 100, they use a different number here, but 100 healthy people, and we're going to compare how many of them have this versus how many people experience chronic fatigue, and then we're going to compare, are they about equal, in which case, if they're equal, then it means no, this very likely is not a contributing risk factor. But if you see, okay, this is what the prevalence is a normal population, but whoa, this is what you see in the chronic fatigue population, it's like, there's something to that. And it means it may not be all of the answers, but that means pay attention to this kind of stuff. Now, one of the first things that they did want to discuss and talk about is they said, okay, if we're going to be talking about joint hypermobility in the upper neck, we need to make a distinction between what is known as Ehlers-Danlos syndrome. What is Ehlers-Danlos? Ehlers-Danlos is a genetic disorder, which is where your ligaments, rather than being made of really tight, strapping, strong collagen tissues, those collagens are made more of elastin, which means that your ligaments are more like really loose rubber bands. And as a consequence, you have a lot more flexibility through all joints of your body, which means that things can pop in and out a lot easier. I have found really within even just the last few years that it's a condition that is becoming increasingly over-diagnosed. People think that because I have clicking and I have pain and I have certain conditions at the base of my neck, I must have Ehlers-Danlos. I disagree with that. So firstly, it's a genetic condition. If you cannot get your thumb to touch the back of your wrist like this, like I obviously can't, then odds are you do not have that genetic condition. Yeah, you can absolutely still have hypermobility in the upper part of your neck, but guess what? It's not because you have Ehlers-Danlos. And even this, even if you can get your thumb to touch the back of your wrist, even that doesn't guarantee that you have it either. What I find, and this is important because in my line of work, looking at the specific relationship between the joint alignment, the integrity, and the neurological function between the top two vertebrae in the neck and the brainstem and the nerve system, is that if you have any of those joints actually lock up, in other words, you've had a physical injury, it's not broken, it's not dislocated, but it's gotten entrapped, and as a result of that, it's not quite moving the way that it was before, it's not quite moving the way it should. It means then that your body, in its innate ability to adapt to stress, to try to compensate, is going to produce excessive amount of mobility in the adjacent areas. And in particular, the C1 and the C2 vertebra, because it's the only segment in the entire spine that lets you do this, is going to be the universal adaptator. In other words, no matter where you may have a mechanical issue in the alignment of your spine or anything like that, but particularly if it's at the very top or just below, in the upper neck one way or another, it means that those ligaments in that segment is probably going to be moving a little bit too much. Why? Because it's needing to do that in order to compensate for other issues that are not moving enough. And the problem is that when you start to say that, oh, that's the exact same thing as an Ehlers-Danlos, no, we are talking chalk and cheese in terms of the underlying mechanism, but also the solution. Just because some of the symptoms may be common, it doesn't mean that you're dealing with the same kind of condition any stretch of the imagination. And so there's a number of articles that are coming out from a lot of the neurologists, orthopedic surgeons, basically saying the exact same thing, that we really are lacking a true diagnostic standard to say, this is when you do have the real deal Ehlers-Danlos versus this is where you're experiencing hypermobility in the upper neck, but you're having it for a completely different reason. And as a result, you need a completely different treatment strategy. So what these guys are saying is that they found that, really in the true population, Ehlers-Danlos, maybe 1% of the population, maybe. And yet 20% of the people in these particular group had been diagnosed as possibly having it in terms of an explanation for why they, would be experiencing chronic fatigue syndrome. Now, we don't actually know. In terms of, this actual study, they said, okay, what we're going to be calling, the true chronic fatigue, no, we have ruled out that this is not the true Ehlers-Danlos. They can't do that, and so there's got to be something else that is actually contributing. What they also wanted to check was what is called a Chiari malformation. What is a Chiari malformation? I've also done a series of videos on this, but in brief, let's say that this little model here, which represents the base of the skull, and this opening, which is where your brainstem sits, imagine that I have a balloon sitting here and a string that comes down through that opening right here. Balloon's your brain, string is the spinal cord. And so normally, at least from a pathological standpoint, that brainstem, the base of that balloon, should not descend through the opening here by any more than 5 millimeters. So what a Chiari malformation is, I want you to imagine for visual purposes that I take that string and I pull it down like this in such a way that that balloon starts to bulge and herniate down through the opening right here. And that's going to put a whole bunch of pressure in and around the back through here. So what they are talking about here is that if and when you have that, and this has actually been supported with other studies, I believe I did a video even earlier this year on that, so we'll give you the link there, that if and when you've got that kind of narrowing, it's like having a solid bookshelf that's full of books, and then you trying to slide just one more in there. You can't do it. It produces a huge amount of pressure, and the consequence of that pressure is it means the normal flow of the circulation around the brain in that area, it's not able to get through, and as a result, that can be one of the things that is producing that internal pressure on the back of the eyes, that intracranial hypertension. And as a consequence of that, that is then in turn producing some of the brain swelling, and they believe may be associated with the chronic fatigue kind of syndrome. What do they say? Interestingly, a high percent of our participants with chronic fatigue exhibited signs of intracranial hypertension, such as cognitive dysfunction. So this can be brain fog. This can be an ability to remember things, loss of short-term memory, inability to concentrate, headache, dizziness, and pain. These are very generalized kinds of things. But nevertheless, they're finding, okay, this is pretty prominent. Now, this is where they start to actually talk about some of the numbers. And what I'm going to do just for simplicity, I'm going to go back to the original summary. Remember what we said is they're comparing this against normal healthy volunteers. And so assuming that there's no link and that there's nothing to this whatsoever, you would expect to see very similar levels between each of these findings in a normal group of people versus people who are experiencing the symptoms of a chronic fatigue syndrome. Now check this out. Excessive mobility was 50% higher than the general population. In other words, double the risk factor. 55% had signs of swelling in and around the optic nerve, and 83% of them had other signs of possible intracranial hypertension. That is, even if they didn't have brain lesions and all of that sort of stuff, they still had a backlog of pressure in their head. And guess what? If you've got too much pressure in your head, that pressure by default is also going to be affecting your brain and how it functions and how you feel in terms of your movement, your sensory, your cognition, your energy, your everything. This Chiari malformation, 32%. So increased it by 32%, more likely in terms of a risk factor. Oh, did I misread that? Yeah, I misread that. Sorry, it wasn't 32%. It was 56%. So it was even higher. And these MRIs were done lying down. When a person stands up, those tonsils go down even a little bit lower. That brainstem gets pulled on that little bit more, which could possibly be one of the reasons why so many people feel better when they lie down and they feel worse the longer that they've been upright. And I found that 80% had craniocervical obstructions. 80%, which is massive. And 76% of overall people, 96% of people had increased pain sensitivity, and all this sort of stuff. But I want to come back now to this one about the craniocervical obstruction. Craniocervical obstructions were frequent in our study sample. Most were disc bulges and hernias, and they were found in 80% of people who were looking at the cervical spine. But check this out. These kinds of obstructions are frequent, increasingly frequent, with increased age, and may be asymptomatic. Now, this is not necessarily because you are getting older, but this is because if you are older, it's more likely that you've had a number of physical injuries. And if then those physical injuries have been allowed to slowly increase over a period of time, those little things can become very big problems. Exponential growth. Snowball, avalanche. Not good. Also pointing out, can be asymptomatic. People can have bulging discs and all kinds of issues in their neck. And they say, oh yeah, I feel just fine. There's no issues with me. Well, I don't have pain, so I don't need to do anything at all. And unfortunately, that kind of thinking, that kind of logic is what can get us into really, really big trouble. Pain is only one sensation in terms of what the brain is going to be processing as far as information. You can have all kinds of other issues and be, quote, feeling fine, but there can still be underlying problems. If you have ever known anyone relatively healthy, but then suddenly heart attack, suddenly cancer, I'm using big examples here, but those are not things that just happen overnight. Those are things that have slowly accumulated over a long period of time, feeling fine until they reach critical mass, and then it is on. Again, compound growth, slow, all at once, just like that. And the same can go with these particular kinds of obstructions. Now, there is a really important obstruction that they didn't actually talk about in this paper at all, probably because they weren't looking for it. And truth be it, this is probably one of the most overlooked causes, in my opinion, when it comes to chronic fatigue syndrome. Let's grab our little model back here again, and let's grab a little plastic model of the top vertebra in your neck. Now, of course, when you're a hammer, everything looks like a nail. I am an upper cervical chiropractor. My focus is in the alignment of this joint. This is not to take anything else from anyone else or to take anything away from anybody else. This is simply showing you what is the relationship between this thing and chronic fatigue syndrome. Well, they found 80% of people have these obstructions. We've already talked about all of the issues that this can cause. The thing that's special about this vertebra, there's a lot of things, but one of them is it is the only segment in your spine that actually does not have a disc. And these guys were looking for disc bulges. The C1 vertebra doesn't have a disc. That's what lets you do this, and that's what lets you do this. In other words, in order for it to move, it is suspended by muscles and ligaments. And those ligaments and those muscles can be injured. How? Whiplash injuries. Doesn't have to be a car accident, but anything where your head goes like this, or side to side, or looking on a computer too much, or tripping over the curve and landing on your shoulder, bumping your head on the car door, sports tackle, sports injury, hitting your head on the pool, getting dumped off a wave. You get the idea. This just can add up over years and decades, the kinds of things. And I repeat, there's not a disc to anchor it in place. So that atlas, which normally lets you be able to do this movement with your head, sits right below the base of your skull, like that. And it normally lets you do that up and down movement like this, and then the side to side, and then turning relative to the C2. Well, I want to pose this as a possibility for the obstruction, okay? So we are looking, I'm going to try to line this up as good as I possibly can. We're looking through the opening. This is where your brainstem sits. This is the communication gateway between the brain and the rest of your body. And I want you to imagine that injury of that vertebra. It's not broken, not dislocated, but it starts shifting like this, or like this, or like this, or like this, or any number of those potential 360 degrees of normal circumduction movement that joint allows you to do. What did it do? It narrowed the opening between the brain and the rest of your body. By their definition, that is an obstruction. But they weren't even looking for it in this particular case. And that obstruction occurring right at the very top. So not just because there's issues a little bit lower down, but right at the base of the head, right at the base of the skull, where all of those vital life centers are, where all of that information going up and down can basically get choked off. And no, we're not talking about, complete severing or anything like that, but really all it takes is a couple of millimeters if your body is not able to quite bring it back into normal control and alignment on its own. By itself, a couple of millimeters, that's not a problem, because guess what? That vertebra is going to misalign, and it's going to move whenever you move your head by at least 2 millimeters in any direction. But imagine what would happen if you had your head essentially in this position all day, every day, for 10 years. Why? Because it got stuck there. By even that couple of millimeters, the compound interest is going to start to add up. It's going to potentially create and find other ways that your body's going to need to compensate. That's going to put pressure in those ligaments. It can cause them to start to stretch. It can cause the muscles to start to tighten. It can cause the posture to go off. It can start to screw around with the blood flow going up and down to your brain. And you feel like you might be losing your mind and all that sort of stuff. But you go have the blood tests and it looks relatively normal. Maybe your iron and your thyroid's all out, but they don't believe it's that. And then you have an x-ray or a CT which shows, yeah, you have some disc damage in your neck and all of that sort of stuff. But beyond that, people say that things are looking, quote, relatively normal. And it's because you may not have pathology, but unless you're looking at things in the right possible way, again, even looking for this kind of a condition in the first place, unless you're looking for it, guess what? You may not find it. It's not because it's impossible to find or it's because magic that only I have. Absolutely not. Anybody can look and identify this, but you have to realize you have to look, and you have to look at it in the right way. Otherwise, you can go around chasing diagnosis after diagnosis after diagnosis for years and years and years, never finding what the true underlying root cause is, until hopefully watching something like this video, you realize that there may be more to it than you've ever realized. And I repeat, this is not to say that correcting or identifying, or that these kinds of issues with the alignment of the atlas or the other vertebra in your neck, that this is the cause and cure of chronic fatigue syndrome or anything like that. Absolutely not. But I am saying, based on these guys' number, the fact that these issues that occur at the upper part of the neck are so common and represent potentially very significant risk factors for people who experience chronic fatigue syndrome. If they're not, and if you're not getting answers looking somewhere else, look here. It doesn't mean that this may fix it all here, but this has probably got a very important role in terms of what's going on. So, gotten a little bit animated there. Sorry about that. And I see that we've just basically hit the 30-minute mark just a little bit back. But I do hope that, by, taking you through this and explaining, what's hidden, if you've never come across this research here before, it's saying, look to the upper neck. There's probably something that's going on there. And at the very least, it is worth exploring if you're experiencing chronic fatigue syndrome. So I hope that you found this video not just, oh, that was nice information, all that sort of stuff, more importantly, valuable. And if you did, then, per always, we, ask you to do the same general kinds of things. So number one, please do like this video. And number two, please subscribe to this channel here. Why? Because it's only by you clicking the like button and then pushing the subscribe button that the algorithms on the interwebs and all that sort of stuff say that, hey, this video is actually worth sharing with other people who need to know this kind of information. So please like, subscribe. Those are the first steps, really. Number two is, whether it was yourself or somebody else, if they need to check out this video, please share this with them. And then the third one, simply put, is if this message has resonated with you, information by itself is rather useless. It's what you do with it. It's the ability to take knowledge and put it into action that can make the biggest step and difference. So what would I encourage you to do? Well, first thing is, well, you check out and see, where would be perhaps the nearest person who have a good proper look at this. What you're looking for is you're looking for somebody who does what's called upper cervical chiropractic. There are a number of different brands and varieties. My particular brand that I do, it's called the Blair technique. So you can go to blairchiropractic.com, or you can also go to a number of different, directories. You can type, Blair chiropractor near me, upper cervical chiropractor near me. And if, of course, you are in the Brisbane or the Southeast Queensland area, despite my accent, yes, I know I'm in Australia, even though I don't sound like it, that check us out. We're at atlashealth.com.au, where we have links to all kinds of other videos like this and information on just about any kind of condition you can think of that would be related to the proper alignment and function of these joints through the upper part of your neck. So again, check us out, atlashealth.com.au. And then, if you'd like to then take even that next step to have a chat with us to find out, okay, if you've been dealing with chronic fatigue syndrome or some other challenging type of condition, get in contact with us and we'll let you know, if we think that we'd be able to do anything to help and if we would be able to accept you as a client to basically reach your healthcare needs. So thank you, as always, for your time and attention in watching this video. I hope you'd enjoyed it. And so until next time, take care and bye-bye.